Namaste, myself Dr. Dharampal Singh Thakur, Assistant Professor, Faculty of Ayurvedic Science, Jayoti Vidyapeeth Women's University, Jaipur, Rajasthan. Today we will study about Cystic Duct, Bile Duct and Hepatic Duct. Last class we have studied about gallbladder, and we already seen how the formation of cystic duct, hepatic duct and bile duct. First, cystic duct. Cystic duct is about 3 to 4 centimeter long. It begins at the neck of gallbladder, then runs down, backward and to the left, and finally end by joining the common hepatic duct at an acute angle to form the bile duct. Here we can see how the formation of cystic duct. This is gallbladder, this is neck, and this is cystic duct. This is right hepatic duct, left hepatic, both join and common hepatic duct. Then they join and form bile duct. So first cystic duct is start from the neck of gallbladder. This is the neck of gallbladder. Then runs downward, backward and to the left. This is to the left, and join common hepatic duct, then continue in bile duct. Next, the mucous membrane of cystic ducts form a series of 5 to 12 concentric folds. In cystic duct, we can see here this type of concentric fold. This is a spiral-like concentric fold. This is called concentric fold, like and act as like a valve. So this is called a spiral valve of Hester. This is not a true valve. Next, bile duct. B-I-L-A, bile duct. Previously we have seen how the bile duct form. Let's see. Bile duct form by the union of cystic duct and common hepatic duct near the porta hepatis. We have already discussed about porta hepatis. Porta hepatis is a structure where many structures are entering or existing. So this is liver and this is porta hepatis. Some structures are passing inside and some are outside, just like hilum of lungs. So the cystic duct union with the common hepatic duct. This is common hepatic duct, and this region is near the porta hepatis. This is some like porta hepatis. Then near the porta hepatis, cystic duct and common hepatic duct unite and finally form bile duct. The measurement of the bile duct is 8 cm long and diameter is 6 mm. Next, the course of the bile duct. Bile duct have 4 parts named by supraduodenal part, retroduodenal part, infraduodenal part, and intraduodenal part. The nomenclature of the part based on the duodenum. Supraduodenal means superior to duodenum. The bile duct runs downward and backward first in the free margin of the lesser omentum, called supraduodenal part. Retroduodenal part means always we know behind part is called retro part. So behind the duodenum part is called retroduodenal part. Infraduodenal part inferior to duodenum and embedded in head of pancreas. This is the head of pancreas, and inferior to duodenum is called infraduodenal part. Then intraduodenal part, when the duct is entering the duodenal part. Last class in duodenum class, we have seen about second part of duodenum, and there are 2 openings for duct, bile duct. So this part is intraduodenal part. Intra means inner side of the duodenum. There are 3 types of sphincters related to bile and pancreatic ducts. Sphincters is the structure act as wall, muscular structure. So the bile juice flow in one way. Because of these sphincters, the opposite way is not possible because of this sphincter. So first sphincter is called sphincter choledochus. Choledochus means bile duct. The first structure is sphincter choledochus. This is terminal part of bile duct in surrounding just above the function of the pancreatic duct by the smooth muscles, which is formed sphincter choledochus. Next is sphincter pancreaticus. Another less level of sphincter is usually not always present. This is found in terminal part of the pancreatic duct. Found in terminal part of the pancreatic duct is called sphincter pancreaticus, and the terminal part of the bile duct is called sphincter choledochus. And the third sphincter surround the hepatopancreatic ampulla is called sphincter ampulla or sphincter of Oddi. When hepatopancreatic ampulla is formed and sphincter present there is called sphincter ampulla or sphincter of Oddi. This is the structure we have seen in image previously. Now we will discuss an image. This is downward running bile duct, and this comes from pancreas is pancreatic duct. Bile duct have a sphincters, its terminal part is called sphincter choledochus. This is spiral like sphincters. Same, the terminal part of main pancreatic duct has a sphincter called sphincter pancreaticus. Both bile duct and pancreatic duct unite and form hepatopancreatic ampulla, and this region has also a sphincter called sphincter ampulla. So there is 3 types of there are three inspectors present in bile duct. Artery supplying in the biliary apparatus. Then first is cystic artery, which is chief source of arterial supply. Then several branch of the posterior superior pancreato-duodenal artery. Posterior superior pancreatico-duodenal artery. Pancreas, duodenal artery. Then the right hepatic artery. Let's see venous drainage. The tuberosities of hepatic veins, cystic veins, which finally open in portal vein, and lower part of bile ducts drain into the portal vein. There are three veins: hepatic, cystic, and portal veins. Next, nerve supply, mostly supplied by cystic plexus situated this region and supplied biliary apparatus, and parasympathetic nerves and sympathetic nerve T7 to T9. Clinical anatomy. In congestion of bile duct or any abnormalities in CBD, CPT, common bile duct. Okay, so they cause pain. Pain is main symptoms for this. So there are three nerves responsible for pain. First is through vagus. Vagus nerve feels pain in stomachs. Then through sympathetic nerves to inferior angle of right scapula. Whenever you feel pain sensation in inferior angle of right scapula, you should find out any CBD pathology causes. Then through the phrenic nerve to the right shoulder. Previously we have also seen about the pain in tip of the right shoulder and pain in tip of the left shoulder. The causes related to gallbladder, common bile duct for right shoulder and left shoulder for splenic. Then referment. Any stretch of CBD, common bile duct or gallbladder, pain referred feel in epigastrium region. This also referred in right shoulder and inferior angle of right scapula. So 3 points is important: right shoulder, right inferior angle of scapula, and left shoulder. These three pain regions are very important for clinical practice. We can see the referred pain and how gallbladder is situated. This is a liver, and see how gallbladder is situated. This is inferior surface of liver, and this is right lobe and this is left lobe. Right lobe, inferior surface of right lobe, there is fossa for gallbladder, and gallbladder lies here. Then we can see CBD or gallbladder stretching or any pathology in bile duct or gallbladder, they can refer pain in first epigastrium, then inferior angle of scapula and right tip of shoulder. Same if any pathology is in spleen, this is the situation of spleen. Any pathology is seen in spleen, then it can be referred pain in left shoulder region. This is gallbladder stone. Next, hepatic duct. Hepatic duct is two types, right and left. Right and left hepatic ducts merge at the porta hepatis, form the right-left lobe of the liver. Means we have seen that liver has two lobes, right lobes and left lobes. So each lobe has a duct called hepatic duct. This is right hepatic duct and this is left hepatic duct. Then they position and unite in a common hepatic duct. We can see right hepatic ducts correspond to right lobes and left hepatic ducts correspond to left lobe. The arrangement of the structure is portal vein, hepatic duct, hepatic artery and hepatic duct. In the porta, hepatic porta, this is liver and this is hepatic porta. The structures are arranged from behind to forward. Is portal vein, hepatic artery and hepatic duct. Now common hepatic duct. When right and left duct unite and form, then is called common hepatic duct. It runs downward for about 3 cm and is joined on its right side at an acute angle by the cystic duct to form the common bile duct. So firstly, common hepatic duct, this side comes cystic duct, common hepatic duct and unite there and form, this is bile duct. In some cases, 1 to 5% cases, there is also present an accessory hepatic ducts. So these are references. Next we will study about spleen. Thank you.